This is an EEG of a 41-year-old man with a history of a right MCA aneurysm that ruptured, and he had a subarachnoid hemorrhage, and he had one seizure. And now he is 2 years post, and this EEG is being done to evaluate whether he can come off his anti-epileptic medication. So looking at our montage, we've got our left temporal chain and our right temporal, and then we have left and right parasagittal, and we have our midline chain right here. So this is a double banana montage. And from the first couple pages here, the asymmetry is pretty obvious and striking. Over the left hemisphere, we see a normal posterior dominant rhythm of about 10 hertz, and we see nice organization here with a frequency amplitude gradient. And over the right hemisphere, the background is much slower. We see a lot of delta activity here. This looks like about 2 hertz activity that's overlying the background. And superimposed on that, we see some faster frequency activity, some theta, and scant alpha activity. And so this slowing, it's hemispheric. It affects the whole right hemisphere, and it's continuous. As of now, we're seeing it just keeps going on and on. We're not really seeing slowing that just occurs occasionally. So again, over the left hemisphere, we see nice normal background organization, but over the right hemisphere, the background is very slow. Also, we don't see the frequency amplitude gradient as well over the right hemisphere. It looks like the slowing is pretty equivalent between the temporal leads here and the parasagittal leads, so we don't see any predominance of one specific area. When we see slowing, we really want to describe it in a few different ways. First, we want to describe the frequency of the slowing, and I've already mentioned that this is mostly delta activity with some superimposed theta. And we also want to mention, is it rhythmic or arrhythmic? In this case, the slowing is really, it looks more polymorphic. All the waves are different. So this is arrhythmic or polymorphic delta for the most part. You also would like to mention if the slowing is intermittent or continuous, and in this case it's continuous. Now we see something else here over the left parasagittal area. It looks a little sharp here and spiky. The patient has a skull defect here. He had an EVD on that side, and so this is a breech rhythm. Because we can't directly compare the left and the right parasagittal regions, it's a little bit difficult because we can't say that this is higher amplitude and sharper than the normal hemisphere, since this hemisphere is not normal. But you can just sort of compare it to the temporal area here, and you can see that this is higher amplitude and sharper than the background activity over here. So with breech rhythm, we see higher amplitudes, we see faster frequency activity, and it's sharper. So we can see things that look like spikes. It looks like this has a phase reversal here, but this is just the breech rhythm. Breech can look very sharp. Epileptiform activity through a breech is quite obvious. So it's very high amplitude and stands out from the background. So as we continue along, we just see more of the same, lots of sharp-looking breech rhythm and continuous slowing over the right hemisphere. We're looking for any obvious epileptiform activity, which we do not see. And here we see a sleep spindle. This is the left parasagittal region, and because of the breech, this spindle is much higher amplitude than this little spindle fragment that we see on the right side. So the patient was in stage N2 sleep there. This is just breech. This is not spindle activity. This is just going on too long. But this is likely spindles here. These are likely sleep spindles. So again, this is more breech rhythm. And we see more spindles with a little bit of spindle fragments in the right parasagittal region. And here's more obvious sleep spindles here. And here the patient is waking up. So we see the background rhythm, the posterior dominant rhythm coming back and then attenuating again. So he's getting drowsy. And more sleep activity here. And we can see in sleep, the slowing does persist. And the slowing over the right hemisphere does persist. And we can see some jerky eye movements here, and then it looks like the patient's waking up and going back to sleep again. And again, this is the patient waking up. The asymmetry is much more obvious during wakefulness because during sleep, the left hemisphere is slow as well. So now photic stimulation is being done. And we're not seeing too much of a driving response here. It would be interesting to see if the driving response was better over the good hemisphere, the left hemisphere, but we're not really seeing that. So that is the end of the study. So this is an abnormal EEG, and the abnormalities we can itemize out are: number one, we see continuous polymorphic delta slowing over the right hemisphere. These findings are consistent with focal subcortical dysfunction in this region and are consistent with the patient's history of right MCA aneurysm and right MCA infarct. Additionally, we see a left parasagittal breech rhythm consistent with skull defect in this area. No epileptiform activity was seen during this study.